Kailangan mo ba ng online physical therapy services o telehealth pero tight ang iyong budget? Dito sa Kakayanan, may iba't ibang packages kaming hinahandog na pwede ninyong pagpilian na naaayon sa inyong budget. Maaari ninyong piliin ang tanso packages na naghahandog ng video call therapy sessions. Pwede nyo ring piliin ang Tambuli packages na nag-aalok ng follow-up physical therapy sessions via call or text. Bisitahin lamang ang kakayanan.org para sa karagdagang detalye.
Nanginahanglan ba ka og serbisyo sa online physical therapy session o telehealth? Pero galisod ka sa imuhang budget? Diri sa Kakayanan, adunay nagkalain-laing packages na ginahatag aron pagpilian base sa imong budget. Pwede nimo pilion ang tanso packages na nagahatag og video call therapy session. Pwede po nimo piliun ang Tambuli packages na naghahatag og follow-up sa physical therapy session pinaagi sa pagtawag o pagmensahe. Bisitaha lang ang kakayanan.org para sa dugang na mga impormasyon o detalye.
Alright, magandang hapon po sa lahat. Good afternoon to all our viewers today. Hello, Jan. Good afternoon.
Hello Josh, magandang hapon at magandang hapon po sa lahat ng mga nakatutok ngayon sa Facebook Live at pati sa YouTube.
Correct. Yung mga nanonood ng live at manonood mamaya po, maraming salamat. This is a very exciting community talk today kasi ang dami nating guests at ang dami nating pag-uusapan, napaka-importante, especially about dementia, Alzheimer's, and age-related memory loss. Yeah. Before we proceed, papakilala lang po ako, no? Ako po si Josh. I am a physical therapist and the founder of Kakayanan Digital Rehab Incorporated or Kakayanan. Kasama ko po ngayon si John, our community manager at co-host ko rin po para sa hapon na ito. Alright. Kamusta ka, John? How's everything on your side?
Hello Josh, mabuti naman. Well, maganda na nakiayon ng panahon ngayon. Medyo maaliwalas ang panahon. So, sana magtuloy-tuloy ito. Kasi pag umulan, syempre, pwedeng maputol yung stream natin.
Wag naman.
Wag naman sana.
Hindi naman mangyari yan. Actually, tama ka, yung panahon very, unpredictable, no? I think that's why, so pasensya na po sa boses ko, no? I'm recovering from a really bad flu. Lahat tayo, we are going through different health, di ba? Ups and downs sa health, eh. So, thankfully naman, I still am testing negative for COVID, pero nakakatakot lang din. And a lot of people at this time, flu season, going through these things. So, ikaw, how's your health naman, Jan?
Well, so far, okay naman. Holding up pa naman kahit na umulan, umaraw. Sobrang dynamic nga ng panahon as you have mentioned earlier, no? So, pabago-bago, napaka-unpredictable. So, napaka-importante syempre na aside from inaalagaan natin yung mga kapamilya natin, yung mga kamag-anak natin, dapat inaalagaan din natin yung sarili natin mga kalusugan, lalong-lalo na ngayon, napakahirap magkasakit, no? Konting ubo, sipon, hala, baka COVID agad. Pero, ayun nga, napaka-importante ng kalusugan. Kasi syempre, pag pag tayo'y nagkasakit and all, so bababa yung productivity natin and sunod-sunod na yung mga negative effects pag nagkakasakit tayo.
Exactly. And I would say hindi talaga sulit magkasakit. So hangga't pwede nating iwasan, let's really avoid getting sick, di ba? All right. So to put a context to this community talk, so September is Alzheimer's month. Okay. So I just want to make a shout out to my auntie Tita Claire, Mami Claire. Hello po, Mami Claire. Thanks for joining today. Ayan, maraming salamat sa oras ninyo. Ngayong buwan ng Setyembre po, pinagdiriwang natin ang Alzheimer's month. Okay, so every month there is a certain it just so happened na ang Alzheimer's Society, different societies promoting or awareness on Alzheimer's designated this month to promote awareness about this condition. Kaya dinala natin ang dalawa pang, meron pa tayong mga kapartner ngayon sa ating community talk. I would say this is the biggest community talk we've had ever since we started this initiative. So with us are Active Care Home Health Solutions na nakapartner na natin matagal na sa una nating talk with about seniors. So thank you, Miss Joan Corpus Araneta, for making this happen. And then also with us, Sunshine Place Senior Recreation Center. So thank you, Miss Hilda Reyes and Miss Che. Che de Vega for making this partnership happen also. With us also is JCI Cebu Hara, which is a group of very passionate young Cebuanos, diba, who are very much committed to grow this initiative with us. So maraming salamat for these three groups in for making this project happen. Napaka-exciting. Jan, what are you looking forward to today?
Well, una sa lahat, what I am really looking forward to syempre is matutunan pa kung ano nga ba talaga ang dementia, ano nga ba talagang Alzheimer's, and syempre ano ba yung magagawa natin para mabigyan ng tamang kalinga yung ating mga kamag-anak na kung meron man ito or hindi lang mga kamag-anak, syempre, yung mga ibang tao din. So aside from kalinga, mas maunawaan natin kung yung kondisyon nila para naman, alam mo yun, kasi di ba karaniwan ang sinasabi pag makakalimutin na, hinahayaan na lang and all, dala lang daw ng pagtanda. Pero mas maganda kasi, no, mas mainam na, mas maunawaan natin yung kondisyon nila para hindi naman tayo yung wala tayo totally alam kung ano yung gagawin natin sa kanila, paano natin sila matutulungan. So mas maganda na may alam tayo para alam natin kung ano ba talaga yung tamang pag-aalaga na kailangan nila.
Correct. Sige, good yan. Ako, I want to understand din dementia. At saka, to differentiate it with Alzheimer's, di ba? Parang, ano ba yung dementia? Ano ba yung Alzheimer's? Sino ba nagkakaroon? Who's prone to having that? And ano yung future para sa mga tao na may dementia? For those who don't have dementia, is it something we can avoid? Is it something that we will all, di ba, eventually have? So, marami din akong tanong at I'm really looking forward to this conversation, right? Siguro po, hingin din namin ang opinion ng audience, no, sa mga naka-tune in sa Facebook at sa YouTube. Pwede po bang matanong sa inyo, ano po ang expectation ninyo for today? Ano po ang gusto ninyong matutunan natin ngayong araw? So paki-type na lang po sa inyong chat dito sa Facebook at sa YouTube. While we're doing that, want to make a shout out to Miss Rosario Mission Bukaw. Maraming salamat. Watching from Caloocan City. Yan. Thank you for tuning in. Ang ganda ng online, no? Kasi ang dami talaga nating maaabot. I remember there was a time may mga nanonood sa atin from Visayas, from Mindanao, from Ilocos. So, hindi man ngayon, halimbawa, later on, Diba?
Oo, tama ka dyan, Josh. Syempre, iba't iba yung mga oras na available tayo kumpara
Correct.
sa yung parang nagtotalk tayo on a certain place. No, kitang-kita natin yung mga tao. So, itong online, aside from pwede siya live, so ayun nga, may recorded naman ito na video afterwards. So, para sa mga hindi nakapanood, pwedeng-pwede nyo pa rin itong mapanood dito sa Facebook at sa ating YouTube page din. So you can watch at your own time or at your own pleasure.
Correct. Tama yan. I would like to also acknowledge Miss Luz Ambrosio. Hello po, good afternoon from Parañaque. O, diba? So, meron na tayong North, meron na tayong South. Naku, kulang na lang. Sana meron taga-Pasig pagpapabate. O kaya taga-Taguig o Manila. Alright. Sige. Okay, so I think we can, ayan, may Parañaque din. Isa ulit, si Miss Maria. Yan, okay. Ito. May mga expectations na tayo dyan. So, basahin ko muna. So, una, may mga certain age po ba yan? I think malalaman natin yan in a little bit. Tapos, anong age daw? Yan. Sa Davao, meron pala tayong taga Davao. Hello po, Miss Chalun. Alright, good afternoon sa inyo. Meron din tayo from Tarlac. Mabati. Ayan na, napupuno na. Ang buong Pilipinas, nandito na, naka-tune in na po. Si Miss Monina, magandang hapon din po sa inyo. And then si Miss Teng. Okay, can we avoid her? Yan, parehas kami ng question ni Miss Teng. O may Manila na tayo dyan. Complete na yung yung mapa natin ng NCR.
May north, may south, may central. Tapos ayan na tawag dito, meron na din tayo from Southern Philippines, so Davao, meron din tayo from Northern Philippines, Tarlac. Ito pa, meron pang isa pang expectation dito from Miss Claire Kakanado. Just want to know the symptoms of dementia. Ayun, nabanggit na rin kung anong age siya mag-occur. Meron pa, watching from Cainta.
Ayan na. Babahan na.
Janeline with Mr. Rizaldi sa Piera. Ayan. Meron
Okay,
pa.
Pasig.
From Pasig, Makati, meron
din. Ayan na, talaga naman. Okay, sige, mukhang exciting na. Nabubuo na yung ating, ito na buhay na yung audience natin. No? So, excited ako actually yung special guest natin, no? Si Miss Cherry at si Miss Baby. Napakaganda ng tandem nila, ng teamwork nila. And that will be really the highlight of our meeting. And I hope they're already tuned in. If not, mamaya makakasama natin sila. Alright? So, let's already kick this off, Jan. So, would you mind sharing the recorded presentation of Dr. Didi Cordelia Didi Formalejo, the head of operations of Active Care Home Health Solutions Incorporated. So, we're very fortunate to have this group on board, Active Care. We had a really good partnership with them, no, during our first community talk about seniors, about aging gracefully. So please look them up po on Facebook. If ever you need support for caring for your elderly, sila. Alright. Sige.
Ayun nga, tawag dito, ngayon ko lang na-realize no? So, di ba yung previous natin na community talk, so it's about aging gracefully, di ba? So, para sa mga seniors. Ngayon, para ulit sa mga seniors ang ating topic ngayon, no? So, aside from aging gracefully, maganda rin siguro na katanungan, no? Ito ngayon ko lang to naisip, no? Paano kaya yung mga may dementia, may mga Alzheimer's, could they still age gracefully din? Di ba?
Ganda. Ang ganda ng tanong. Kasi yun na ba ang... That's great. Exciting to.
Alright.
So, turning you guys over to
Dr. Didi. Okay. Oops. Yeah.
Okay. Hi, Josh, and good afternoon.
Alright,
Ilan po natin ang audio. Nahiya po ng konti video.
nagkaroon tayo ng konting technical difficulty. Sige, check
Gusto
natin.
ko yan. Yung huli mong sinabi dyan, that's very powerful. Kasi, di ba, hindi natin alam. Pagka meron ba tayong condition like dementia, may pag-asa ba tayo na mabuhay pa ng matiwasay, di ba, gracefully, aging gracefully. I really love that perspective. So, looking forward to that.
Okay.
Yan, ito na po. Tingnan natin.
Okay. Hi, Josh, and good afternoon to everyone watching live in Facebook, as well as to those who will be watching the recording of this talk. So I'm Dr. Didi Formalejo from Active Care, and today I will be explaining the basics of dementia. Basically, it's Dementia 101, no? So ever since I started my practice, where a lot of people or patients have been asking me, what's dementia? Is dementia the same as Alzheimer's? What's the difference? So is it curable? Is dementia a normal part of aging? And I even have titos and titas para asking me, Didi, nagiging makakalimutin na ako, may dementia na ba ako? So in the next few minutes, I will be answering these questions, and hopefully everyone can get a better understanding of what dementia is. So dementia, it's a disorder. So it's not a normal part of aging. Not all senior citizens will have dementia, okay? So, but as we all know, a lot of seniors have dementia, but not everyone will get dementia. So dementia, it's a disorder characterized by deterioration of cognitive function. So cognitive function, it's what we use to acquire knowledge and to understand everything that's happening around us. So of course, now if you have a problem with this, then you have a very difficult time living your life because you can't understand what's happening. So there are different aspects of cognitive function, and the most important that's related to dementia, it's memory loss, and this also involves learning, no? So, but aside from memory loss, to be able to say that one has dementia, the other domains of cognitive function should also be affected. So it could either be language, executive function, complex attention, social cognition, perceptual motor function also. And at least one of these should also be affected. Pero parang very complicated terms, no? Ano ba mga to? So when we say language, it's how we communicate. So this includes naming objects, finding the right words for certain objects, and even how we talk, no? So kung mapapansin nyo, parang some patients with dementia, parang, pakuha nga ng, this, eventually they can't say what it is unless you feed it to them. So that's language. Executive function naman is how we plan, how we prioritize, how we make decisions, how we respond to our environment, no? So if you'll notice, parang patients with dementia have a hard time completing tasks. Kasi in the first place, they couldn't even plan how to start that task and eventually fulfill it. So usually, no, yung mga ginagawa nila dati, parang they can't do it now kasi parang it's hard for them to think on how they're gonna do that activity. And then number 3, there's also the complex attention, which is how we focus despite all the distractions around us. Kaya, so mga dementia patients, they have a difficult time completing a task. Kasi, for example, a task that previously, they can do in just a minute. Sometimes it will take them 5-10 minutes, or sometimes hindi pa nga nila nakukomplete yung task. That's because they have a very difficult time focusing on that certain activity. And that's where complex attention comes in. And then another domain is social cognition, which is parang how we act in social context. So this involves our controlling our impulses, expressing empathy to others, recognizing social cues, reading facial expressions, no? I think perfect example is controlling impulses. Kung mapapansin nyo, patients with dementia, yung iba parating galit, no? Parang kahit na you're not doing anything, papasok lang ako sa kwarto, galit na kaagad. Kasi yun pala, hindi parang our relative with dementia, no, can't understand the things happening around us, but instead of telling you what's happening to her, since she can't control her impulses, galit na siya kaagad sa'yo. So, let's not blame our patients kung bakit sila galit, or let's not blame ourselves kung bakit sila galit. Kumbaga, they just have a problem with social cognition. And then last domain is the perceptual motor function. So this is the ability to coordinate the movements of our body. So this is, I think perfect example dito is walking. Kung mapapansin nyo, sometimes patients with dementia, ang bagal maglakad or parang ang clumsy, no? Ang dali nilang matumba. That's because they have a hard time perceiving, no, what they see. Kunyari, yung floor na yon may steps pala. Hirap silang makita yung steps na yon. They have a hard time perceiving those steps. So sometimes, di nila alam may step pala, natutumba sila. So that's because of perceptual motor function. Okay? So, kaya when we say dementia, it's not just memory loss. Okay? It's about, kumbaga, everything we use to do our usual activities. So, it involves these different domains of cognitive function. So, what's difficult with dementia is that it's progressive. So, kaya ang daming mga relatives who complain na, parang before naman, she was able to take a bath by herself. So, why now? Bakit ngayon hindi na siya nakakaligo by herself? Why does she need assistance? Because that's how dementia is. It really is progressive. So, it has a spectrum from mild to severe dementia, no? And eventually, even with all the meds, dadating at dadating talaga ang patient sa severe dementia. Unfortunately, there's no cure for dementia. So the meds available are just to help control the progression of dementia. But eventually talaga, patients with dementia will eventually go to the severe side of the disease. And as the dementia worsens, so patients eventually lose their daily functions, no, and they become dependent on others. Kaya for patients with severe dementia, talagang it's the family who takes care of them, who bathes them, feeds them, does everything for them, or sometimes they hire caregivers or nurses. So there's several risk factors for dementia, and obviously, the most common or the strongest risk factor is age talaga. So the older you get, the high likelihood that you'll get dementia. And then there's also genetics, no? Kaya 'di ba yung iba sinasabi na nasa lahi talaga natin 'yan. So this is especially true for Alzheimer's dementia. Parang there's a high high risk that if your parents have dementia, then ikaw then might have dementia as well. And then there's also history of stroke and cardiometabolic risk factors like diabetes, high blood, elevated cholesterol, obesity, smoking, and other vascular diseases such as heart attack. No? Kasi if you have these risk factors, then the higher chance to have a stroke. A stroke can also eventually cause the dementia. And then other risk factors include low educational attainments, physical inactivity, and social isolation. So yung mga mag-isa lang sa bahay, alone, especially as they age, no, sila usually yung mas madaling magka-dementia. And then, there are different causes of dementia. So, di ba, ang daming nagtatanong, parang what's the difference between dementia and Alzheimer's? Actually, dementia is the umbrella for the different causes. No? Under dementia, you could have Alzheimer's disease, which is the most common cause of dementia. Then there's vascular dementia, which is usually the dementia for patients who had a stroke before. Then other less common causes, there's Parkinson's, pwedeng dementia with Lewy bodies, there's frontotemporal dementia, and other causes pa. No? There are many causes of dementia. Ang pinaka-common lang talaga is Alzheimer's, followed by vascular. So in the Philippines, so there's this study, no, conducted in Marikina. So, based on the study, parang the incidence of dementia is 16 new cases per 1,000 senior citizens per year. So dementia is more common in females rather than males. And here in the country, Alzheimer's disease is still the most common type of dementia, followed by vascular dementia. So what causes dementia now? Why do patients have it? So most types of dementia, this includes Alzheimer's, Lewy body dementia. So they are caused by accumulation of toxic proteins in the brain. So since it's toxic, so the tendency is, of course, yung mga cells natin in the brain wants to, to degrade those toxic proteins. Unfortunately, as they degrade those toxic proteins, parang the brain cells or the neurons also die with it. So eventually, parang the brain shrinks because of this. So in Alzheimer's dementia, there's the amyloid plaques, the tau protein. For dementia with Lewy bodies, the toxic protein is the Lewy body, etc. So meanwhile, for vascular dementia naman, which is the dementia seen with patients with recurrent strokes. So what happens kasi when we have a stroke, so the brain cells or the neurons parang lack oxygen. And when they lack oxygen, they die. So as when the neurons die, eventually the brain shrinks. And that's what causes the dementia. So what are the symptoms of patients with dementia? So we all know yung forgetfulness. Talagang makakalimutin sila. Pero aside from forgetfulness, there's also difficulty with other tasks, such as retaining new information. So kaya mga patients, they have trouble remembering events. There's also difficulty handling complex tasks. So for example, dati naman nakakapag-grocery si Lola. Bakit ngayon hindi na? Kasi it's part of the complex task, no? Kasi when you go to the grocery, that involves deciding ano bang sabon panlaba pipiliin ko or paying. So, magka-count ka ng money, magka-calculate ka. So, those are complex tasks. And then, number 3, there's also reasoning. So, for example, there are unexpected events. So, events, no, that's not part of your daily routine. So, sometimes it's very hard for them to comprehend these events. And then, there's also difficulty with spatial ability and orientation. So, for example, dati naman, you always go to this mall. Bakit ngayon parang you don't recognize the mall or you don't know how to go there? Kaya 'di ba? There are dementia patients na nawawala na lang kasi parang they forget those places already or how to get home. And then there's language, which I said kanina, no, na parang they have a hard time saying what they want to say. Parang, pakuha, no, yung mga ganong bagay. And last is behavior. Yung iba, parating galit. Yung iba naman, tulog ng tulog. Or for some, parang they're very depressed. So, I just like to emphasize na dementia is not just memory loss, but there are other vital functions that are also affected with it. So, I hope that everyone has a clear understanding of what dementia is. And later on, parang Dr. Mia, Active Care's affiliate neurologist, can answer your questions on dementia. So thank you, Josh, for inviting me again. So I hope na parang everyone who's watching may bagong information on dementia. So thank you, everyone.
Thank you also, Dr. Didi Formalejo. Wow! How did you find it, John? Kamusta yun?
Maraming questions actually yung na-address na doon sa short lecture ni Doc Didi. Especially yung sa ngayon ko lang actually nalaman na marami palang klase ng dementia. Hindi lang pala Alzheimer. So, alam mo yun, yung even Parkinson's pala, nagkakaroon din pala sila ng dementia.
And then yun, magandang maintindihan din yun. Nasagot yung main question ko nga. Ano yung difference na dementia, Alzheimer's, bigger term pala yung dementia. Tapos may mga maliliit na or smaller kinds, di ba?
So kumbaga yung yung Alzheimer's, it's a type of dementia, yung
Correct.
vascular dementia, it's another type of dementia. So alam mo, magkakaiba sila ng clinical features, 'di ba?
Exactly.
Magkakaiba ng sintomas, ng signs and
Mhm.
everything.
For our live audience, feel free to comment lang din po. So we're taking note of several comments. I just want to acknowledge Mr. Roel Romana, who has been very active in sharing his experience. So let's read his, John. Can
Okay
you
po.
read his?
According to Sir Rowell, his mother died of dementia, and it was a very terrible sickness. He also mentioned yung attending neurologist po ng kanyang mother is Dr. Socorro Martinez from St. Luke's.
Thank you, Sir Roel, for sharing that experience. So later po, I'm seeing your questions here. Later, when Dr. Ramia jumps on board, it would be good to have you stay online. I think marami po kayong mako-contribute sa conversation natin today. Alright. I took some notes dyan. I hope you don't mind if I just share yung mga na-pick up ko talaga from Dr. So the first one is it's not just memory loss, but it's loss of also major functions of the brain. Diba? Ang dami-dami, if you think about it, napakadami pala ginagawa ng brain. Diba? Yung mga bagay na we think we naturally do, may mga proseso pala na involved. Diba? Yung pagpili ng coins, for example, pagpili ng grocery, lahat yun may mga may mga brain functions that are involved. Okay?
Tama ka
Yung
dyan. Ultimo nga yung di ba? Minsan naririnig natin yung mga automatic functions na tinatawag. So dahil brain nga, utak natin ng gumagawa naman ng lahat ng bodily functions natin. So for someone with dementia, ultimo yung iba nakakalimutan na yung involuntary na paghinga. Diba? Minsan nakakalimutan na nila paano ngumuya ng maayos, yung pagpunta sa banyo, or even yung simple na magsasalita, nauutal-utal na or hindi na talaga mabanggit yung gusto nila sabihin.
Correct. I recently had an interaction with an elderly na wala pa naman akong ginagawa, sinungitan ako kagad. So, nagulat lang din ako, parang hindi ko naman na-expect, parang galit ka agad. Siguro hindi lang ako nakakaranas nun. I'm sure we individually, we see people like that. And sometimes, kaya nga hindi dapat natin pinapersonal. No? Minsan we don't see where they're coming from. Baka yung body nila yun, yung brain nila yun, hindi nga napaprocess. Yung tinatawag ni Doc kanina na inhibition. Pag sinabi mo natin inhibition, yun yung pagpigil natin sa mga bagay na hindi dapat ginagawa. Halimbawa, pag gusto mong kumain na lang bigla ngayon, di ba? Kasi nagpe-present ako sa inyo, kahit gutom ako, kailangan pigilan ko because this is the proper, alam mo yun. So, kung wala akong inhibition, kakain na lang ako basta, or inom lang ako basta, or lalabas na lang. You know what I mean? So, pagka wala tayong adequate brain function, yun yung nawawala.
Kumbaga yung mga how should I say this? Yung socially inappropriate na mga actions, di ba? So dahil hindi na maayos yung inhibitioning function ng ating utak, so may tendency na yung ating mga let's say yung mga relatives or yung mga matatanda with dementia na ay yung on the fly na lang nila gagawin.
Correct. Uy, I think this deserves a bit of recognition. Sir Roel, thank you for the acknowledgement of my input. It's my mother's 91st birthday today. Happy birthday po in heaven sa iyong mother. And thank you for being here. I hope you can share your experiences later. We are going now to our highlight of our chat. Okay, so meron tayong i-feature ngayon. Members of Sunshine Place Senior Recreation Center. Miss Jericho and Miss Baby Babaw. I think, Jan, if it's ready, we can already share our interview with them. Subukan natin. So,
Okay.
keep the comments coming lang po habang naghihintay tayo. Yan. Ang dami pa nating viewers from different parts of the Philippines. May Taytay ulit tayo. Taytay Rizal. Yan. Yung Rizal ang naging escape ko during pandemic. Yan. Daling pumunta sa Rizal. Actually. Good afternoon. And then si Miss Angela. Oy, meron tayo from QMMC. Thank you po. We need some health workers tuning in. Appreciate it. We appreciate it so much. Good afternoon. Ayan. Sige. Let's see. Meron tayo from Quezon City, Miss Hedina. Maraming salamat po for watching. And also, meron ulit si Ma'am Evelyn from San Fernando, Pampanga. Wow, di ba? May Tarlac, may Pampanga pa tayo. Tapaw. Alright, sige po. Let me just... We can go on a quick...
Yan. There.
Good. Alright, sige po. We are...
Good afternoon to everyone watching our community talk.
Good afternoon. Good afternoon, Josh.
All right. Good afternoon.
Good afternoon.
So, medyo hindi cooperative ang internet natin.
Ayan. Nangyari.
Nabati kanina.
Ha?
Nabati ko kanina na sabi ko, di ba baka magkaroon ng connection problems or everything. So, ayun nga yun nangyari. Ayaw nang makikooperate ng internet natin pareho.
Alright, sige. Let me just try... Okay, I can try from my side if you like.
Okay.
O sige, or meron ka nung yung backup na lang natin, please. Number.
Sige.
Thank you, Miss Joanne. Ayan, ako, ang ating active care boss.
Good afternoon
Miss
to
Joanne,
everyone
our lady
watching our
boss, for
community
making
talk.
this happen.
Good afternoon, Josh.
Good afternoon. All right.
Good afternoon, everyone.
Good afternoon. I have two beautiful women with me today. Very privileged to have them in our show. So I'd like to introduce Miss Enrica Baby Babaw and Miss Cherry.
Hi.
All right. So we've just listened to Dr. Didi about explaining about dementia, about why it's happening, about who gets dementia, etc. And now we're going to hear firsthand experience from this beautiful family with me as they went through this situation. So, Miss Sherry, if we can start, tell us about our main guest for today.
My mother is Enrica Concepcion Unchua Bacao. She is 82 years old. She was born in Davao City, Philippines, and now she's with me here in Manila. Yeah.
Great. How are you feeling today, Miss Baby? Everything is we're starting with a very positive note. Okay. So, can you talk me through her schedule here at Sunshine? So right now we're here at Sunshine Place at Jupiter, my second home, my home in Makati. This is a place or haven for senior citizens. Does she do classes here?
Yes. We are very blessed and lucky that Sunshine Place is existing. Not because I'm not doing any marketing here, okay? But I just want to share and inform everyone how this helped us in our journey together with Mommy. Before the pandemic, okay, Mommy was very active in almost all Sunshine Place activities and made her very busy. She does tango, salsa, chair dancing, music, singing, brain exercises. Yeah, so I make sure that almost all of her schedules are really, really very busy. But of course, that's a 1 hour per session. It's not busy 2 hours to 5 hours. Yeah.
So within, so it's just filling the day with, or filling the week with different activities, right? So as we know, dementia really affects the brain, the nervous system. So we have to constantly stimulate it, to get the maximum benefit.
Very true.
What have you seen? How did these activities go?
It did not progress the dementia because prior to the previous years, I always make sure to give mommy the checkup with his neuro doctors. And one thing that is important for us is that the dementia did not progress.
Correct. Beautiful. So that's one thing also that I want to emphasize. With conditions like dementia, we can still do something about it. So similar to scoliosis, arthritis, these are conditions that we encounter in physical therapy. And a lot of people, when we know that we have condition, a lot of people just give up and accept it. And we have this bahala na mindset. And I'm happy to meet someone who did not just give up. So what was it like when we heard of this diagnosis?
Can you help me first define in your term and then I will translate dementia for you?
Dementia for me, okay. So dementia is a deterioration of our brain function. So in layman's terms, I think Dr. PD can revert back to our lecture about this. So it's a progressive disease, right? That a lot of older folks function or experience later in life because of the degenerative changes. Yeah.
In my case, as a doctor to mommy, okay, we are not in a medical field. For me, it's a start of like forgetfulness, and it's getting maybe more serious and more often. So correct me if I'm wrong.
That's right. That's
So the dementia, we don't know actually when this started to mommy. Like specific date. It's not like okay, September 10, 2020. No, it's not like that.
right.
Okay? You just observe it sometimes or oftentimes. We might even feel like I'm at I'm by the way I'm 51 and I feel like I'm so forgetful right now.
Correct.
And a lot of people will agree to me and say like, yeah, I'm already there. So we don't really know when is the specific actual date that it started.
Okay.
But what we know is that yes, when we had a check, there is already signs there, so it's present. So the important thing is that it does not progress or it does not elevate into more severe, problem.
That's beautiful, and this is why we use the term. Excuse me. We use the term degenerative and progressive because this just, as Ms. Cherry mentioned, it progresses over time, and we cannot really trace one day. Diba? It's like a series of forgetfulness one time. What were the most significant memory loss incidents from your
They always say that the short-term memory or the short-term activities are the ones that can easily be forgotten.
correct?
And they always say that the long-term or the ones that the mommy had before, she remembers. Actually, I think with personal experience with mommy, it does not follow like that. Okay, so maybe it's a unique case-to-case basis because, example, mommy can say, "Oh, my favorite mommy," diba? You say, "My favorite food." That's a long term. She will definitely remember. Everyone remembers your favorite food, but then mommy cannot remember things. Mommy Mommy, what's your favorite food?
What's your favorite food, Miss Baby?
Mommy. Gusto mo ito ko. So,
Your
yung
favorite
favorite
food?
gusto mong pagkain? Like, lengua ba? Adobo ba? Kare-kare?
Lengua.
So, yeah. So, it's actually giving her support, which means give her 1 to 3 samples, which like what I did. Okay. So, if you're saying a long term of like that, everyone knows your favorite food. You would remember what's your most favorite food, right? Yeah. So, on a specific topic, maybe you can. So, that was a sample of a food. I mean, what's your favorite color? Yeah. Yes. Perfect. Correct. Yeah. So I think it's more of the topics and the sample of questions that you ask her. So
So it's like contextualizing
correct.
conversation so that it helps your brain to process the information. Okay, good. Okay, so how is it affecting the family dynamics? Was there any changes in the family setup?
For the family, nobody is actually prepared for this. Nobody can say that I'm ready to face dementia or take care of dementia. And one should actually be um, um, ready in a way that commit, okay? Because when you see, it's like taking care. I'm a single mother. Okay? It's like taking care also of a baby or a child. It's similar of taking care of money. So it affected in a way that sometimes there will be some misunderstanding, or probably one would feel what is she thinking, what does she feel, this and that. So um, we were not really open of what would the other family feel. So we as the adult, or probably not in the position of a senior, should just maybe vocalize and open up. That's important. So when there is no support in the way that you don't open it, the topic,
Correct.
it's going to remain vague to everyone. Okay, it's going to remain that you don't understand each other, or they will not understand what it is in our world here with money, or maybe I have to also be conscious of what are their lives also individually.
Correct. Must be really challenging, right? Because as you said, we're adults. We have our own families, own needs, and then in our culture as well, we really look after our elderly. So, and as you said, it's very important to communicate with our family members because we don't usually do that, right?
Yes.
Philippine culture is very
Yeah.
like
Mm,
pakikiramdam, pakiramdaman,
Assuming.
other, oo.
yeah.
And then that's one thing that I think we should start learning, growing as a culture to be more open, talking to family members. So how do you manage given this?
First is it's there is no particular formula on how to manage things. It's really like identifying consciously. It should come from within that. When I started taking care of money, um, I really I saw that this is what happened to her, that she's progressing dementia. It should not happen. I have to come up for myself that I will make money. I have to commit to make money and look for a way for money to have activities. Okay, I will not settle for like no, this is just she will just stay at home because I work. I'm a single mom and I work. Okay, but I have to find a way that when I am working, I have to divide myself to look after her, where she will go, how is she going to be brought here to Sunshine, and who else is going to be with her? So
Yeah.
I'm very lucky. I have the office, my bosses, my partners at work that understand the situation. So there are times that I have to juggle, and sometimes I will come with her, but there are some times that I cannot be with her. But I have the angels, the caregiver, and the staff with me. I make sure that we meet before the start of the care plan. We meet, and I tell them the expectations. I tell them everything, the condition of money. I don't want to settle that. I always tell them, if you're going to touch money and look at money, take care of money, don't fake it. Don't, because I'm very conscious, and I would feel it. I would want that when you touch mommy like she's your mom. Okay? I will not settle. If, of course, we have experiences of we change one, second time caregivers, and you as a daughter should feel that. It's just like when you have a yaya, and your yaya is not really taking care of her child. Same as with mom. If I know that caregiver or staff are not real to her, you have to do something, change. And you have to also admit, because there are also children, adult children would say, but I'm busy, but I have work, I have like that. So you have to really find a way. It's like when you have a child, how will your child eat if you're at work? So you can find time. So I have to find a way that when I am at work, even during the pandemic, there are sources. Obviously, you have Wi-Fi at home.
Right.
Turn it on. Sunshine is online.
Yeah.
Okay. And during times that there are no sunshine, there are a lot of online help right now.
Correct.
So there are also activities that I do and I initiated that are not from sunshine.
Right.
Example, I bring even inexpensive coloring books.
Okay.
Okay, I ask mom because she has to keep on moving,
Right.
thinking, and doing something. So I ask her at her own given, time and
Right.
color choices. I sent you some
Yeah.
samples,
So
right?
beautiful photos.
Yeah, so you can show that, mommy, the colors that you do. She colors it, and you can see walang lampas.
Wow.
Okay, the color that she makes, it's not on sunshine, but even at home you can do it. You can. There are reasons that other would say, oh, it's expensive. Yes, okay, but you can do the coloring is on your own. You can even get the coloring from, you can draw. So
Yeah.
mommy
Okay.
draws, and then we also make sure to give her paper and pen that she will write journals.
Okay.
Always ask mommy, what did you do today?
Right.
And then we have a family portrait. Okay, it's a family tree.
Right.
One thing that we don't want her to forget is her family.
Okay.
Even if the caregivers and the eyes are saying ulit ng ulit, it's okay. So that mommy don't forget your children, di ba, no? O palagi uulitin ninyo, it's okay. You just have to also be patient. Uulitin, okay? And then those are the non-sunshine, or you don't have to pay anything.
Correct.
Sing along, okay? You can do that, okay? But mommy has to be guided. Not karaoke, but to sing together. Yeah, doing it together, but never to leave her alone
I am excited to hear your voice.
later.
I am excited to hear your voice later. Will you sing for us later? You'll sing for us?
Are you going to sing, mommy? Mamaya? Okay? Okay, mommy?
Okay. Sounds like a very demanding, part of life, and I really commend you. Just listening to you, I can just feel how much demand, this takes, and to commit, your life to taking care of your mother. That's admirable.
And thank you to the caregivers
Oh, for
and
sure.
the angels of mommy.
Our angels.
Yeah, without
Nag-video ngayon.
without them, I will not be able to do it on my own. And the doctors, because every 6 months, I make sure to bring mommy to her doctors to continue to guide.
So it's a
And the
collective.
family, sorry.
Yeah.
The family are there. Every now and then, we also do a Zoom. Actually, I'm the only one here in the Philippines, and my siblings are in the US.
Okay.
And some of the family members are in Davao and Canada. So, but we do take time to have a Zoom meeting
Right.
to, you know, communicate better.
So beautiful. I think one of the things that the last 2 years opened for us is the opportunity to maximize the internet technology to connect, to stay connected, even we have family members overseas. Okay, so I really learned so much from what you shared, and maybe if you can wrap up and give us tips about for other families who are going through the same situation.
Um, Number one, for me, personally speaking, for the care of money, okay, um, there should be no fall. Fall in a way that physical care of money at their age, that's one thing that is we are very cautious about is uh, mommy should never have any fall accident. Another, in no particular order, mommy should never be left alone. Okay? I feel that her loneliness will trigger more anxiety and stuff like that. So don't leave your parents alone. Okay? And for adults like us with parents, don't give up. Don't feel like you're just waiting for time. No, um, they deserve happiness. They deserve the when you see mommy smile, when you see mommy that she's really actively participating, the joy that you will get is really unmeasurable, you know. And go for it. Whether you can come here in sunshine or you can do it at home, just do any activity for your moms, for your parents, because they are just waiting. They need us. They cannot do this on their own. They really, really need us. And when you do it, you do it with emotions, real emotions, because they feel um, if you're just going to do it half-hearted, then maybe other people can be able to do it for you. But when you do it with all your heart.
I'm so touched.
You
Muchas
ready?
gracias por tu tiempo. Thank you for your time. Really appreciate this conversation. You have a message for your daughter?
Cosa mo to quiere hablar conmigo.
Por tu hija?
I love you. And we love you too. Okay? Everyone loves. Okay, mommy?
I just met you, but I love you too.
Oh.
Encantado mucho. Okay, thank you. Thank you for your
Thank you very
time.
much, Josh. And I hope it will bring awareness to everyone to take care of their parents, their moms. They're just waiting for us.
And they're here. And maybe let's acknowledge these angels. Dali kayo dito. Pakilala kayo. Our caregivers who ano na? Okay, para lang let's make it complete because
Opportunity to thank
Yeah.
the caregivers of mommy that even if I'm not at home, they are the ones taking care, giving the special touch to mommy day and night.
so this wouldn't be this beautifully managed if not for our caregivers as well, doctors, family members, Sunshine. So
Sunshine.
it's a whole community,
Yes,
no?
yes.
Parang maybe we can say it takes a village also to look after.
And also, by the way, Josh, okay, for some of you or most of you with moms, make sure they look beautiful. Yeah. Bawal kay mami na walang lipstick. I always tell the caregivers, pag namulang yung lipstick ni mami, walang sweldo. Oo.
Eres hermosa.
Mm.
Muy hermosa.
Okay. So always make her feel, lift up her spirits.
Thank you so much. This is such a wonderful time spent. And I think we have something special coming up.
Yes.
Merong piano dito.
Mm.
So we'll take a pause muna. Thank
Thank
you, Miss
you.
Cherry. Thank you,
Thank
everyone.
you.
So we'll take a pause. Thank you, Miss Cherry. Thank you.
Okay. Magandang hapon ulit sa lahat. Pasensya. Ay, sorry. Okay.
Ayan. We would like to thank everyone po for bearing with us. We sincerely apologize po dun sa mahinang audio nung recorded video po nung aming interview with dun po sa Sunshine Place. And don't worry, we will post po yung full recording nitong video po, yung video interview in our page. So, para po mas marinig nyo po ng malinaw yung buong conversation po.
Opo, napakaganda. So, pasensya na po na overlook namin yung audio quality. So, hopefully, makabawi kami when we post this. Yan, opo. We will post these videos din po later dun sa event page po natin sa Facebook. Okay? Alright, so we're going to our next segment of our talk. So, we have a live Q&A. Ito na. Pinakamahalaga din, napakahalaga ng having experts on board, di ba? I think when we started this community talk, nagsimula ito with our group of physical therapists. And then eventually it grew and grew and grew. And now having experts to answer questions is such a privilege. So, our expert on board today who can answer our questions is a graduate of the University of the Philippines, Philippine General Hospital, College of Medicine class of 2015. She took up adult neurology residency in the Medical City, Ortigas, and currently is practicing as a neurologist in the Medical City Main Hospital and Satellite Clinic, Long Center of the Philippines in Quezon City, and La Consolacion University Hospital in Bulacan. She's also an affiliate neurologist of Active Care Home Health Solutions. May we call on board Dr. Miriam Catherine B. Dantes, Dr. Mia. Welcome po sa ating community talk.
Hello, good afternoon. So I'm Dr. Mia Dantes. So thank you for that awesome introduction. So I'm a practicing adult neurology here in the Philippines. So
Doc,
okay.
may we ask, what's it like being a neurologist po sa Philippines? Do you go through, what's the life of a neurologist like here? Out of curiosity.
What's the life of a neurology here in the Philippines? Well, it's exciting. And then you have many opportunities to actually help the people, especially those in the provinces, since neurologists are actually very few here in the Philippines. So there are lots of opportunities to actually help Filipinos, especially in the province. And another one is that there are many opportunities to actually bring the learnings from abroad back to the Philippines. So there are actually a lot of neurologists who also study abroad to actually bring what they learned from the US, from Canada, from Korea to the Philippines, so that they can actually help more people. So that's
That's very
neurology is
interesting.
very exciting. Yeah. So for those undergrads who haven't decided yet, you are welcome in neurology.
Yan. Sa mga kids who are not yet, who don't know what to do yet in your life, neurology might be for you. All right, Doc. Any reflection on the what we've seen, siguro what you've seen from Dr. Adidi's lecture and then from the experiences of Miss Jericho? Maybe we can start with that and then we can answer the
Okay.
questions.
So from Didi's lecture, I actually saw it too beforehand. She made it,
Ah,
she sent it to me. So it was very good since it was simple. It's for everyone since based on experience I actually had this layman talk about dementia in way back in Zambales while I was a resident. People there are actually very curious about dementia. The only disorders they were very curious about were dementia and stroke. And then dementia was actually, they had more questions in dementia compared to the other diseases of neurology. So you can see that for laymen, also for those in the provinces, they're very interested in dementia. So it's very good that you're opening this as Slay Forum with the topic of dementia. And second, from the interview you did, I highly agree that support from the family and support from the caregivers are actually the most important thing for dementia patients. They can actually still emotionally feel your presence and emotionally feel your support. That's why it's very important. And I understand that at one point in the life of a caregiver, it would be tiring. Okay, so there is such thing as being fatigued or tired. But at the end of the day, um, it's still rewarding kasi they'll feel that the patient they're actually taking care of or the relative they're actually taking care of still feels their presence. So I think that's the most important thing about dementia and the families related.
mm, I see. All right. Thank you, Doc. I mean, that also needs to, it's very helpful to understand that because sometimes if the function nga, the cognitive function is
Mhm.
lost, we kind of feel like, oh, baka di naman nila naintindihan if we're nagdadabog lang or what. No? But they
Mm.
actually feel it, no? Tama ba? Ramdam nila yon.
Yes, yes. I believe so. I want to believe so. And I think the relatives would want to believe so. And from the dementia patients I've seen, I can see naman na they can slightly understand the ones taking care for them. Yeah. And
Right.
then another important thing I saw is the support group. Support group among families, support group among patients with dementia is actually very important. So yeah, I saw that script in your video.
That's great. Okay. So I guess we can proceed with our Q&A. So keep the questions coming po. So I'm just gonna flash the questions here, and then John, do you mind reading for us? So I'm just gonna.
Yan. Actually, marami po tayong questions
Mhm.
dito right
Mhm.
now. So,
Mhm.
first unahin po natin tong question ni Miss Rosario Bukaw. May certain age po ba na nag-o-occur ang dementia?
Okay. So, that is very complicated to answer since dementia is just an umbrella term. Okay. So, dementia actually is a syndrome. So, it comprises of several intellectual disabilities of different combinations. So, before I answer your question, there are many kinds of dementia. Okay. The most common are caused by your cerebral atrophy. So, what are these? Your Alzheimer's disease. I think most of you would know about Alzheimer's disease. Your frontotemporal dementia, your Parkinson's dementia. So, those are some of the dementias which are caused by cerebral atrophy. Okay, so other causes of dementia would actually be your multi infarct dementia. So it's a dementia from previous strokes. So a patient who had several previous strokes before can actually have what you call as vascular dementia. Okay, so other kinds of dementias are caused by tumors, brain tumors, cerebral trauma, you also have AIDS dementia, you have hepatic failure causing dementia, you have hypo or hyperthyroidism causing dementia. So there are still a lot, okay, of factors that can actually cause dementia. So from that, you would know that the ages would differ. Okay, so I think you're pertaining to Alzheimer's disease, since Alzheimer's disease is the most common dementia. Okay, so regarding the age of Alzheimer's disease, which is actually the most common dementia, you you have what you call as your early onset Alzheimer's, which is very, very rare, and then your late onset Alzheimer's disease, which is the most common. Okay, so early onset Alzheimer's would usually occur in patients less than 60 years old, while your late onset Alzheimer's will be present in patients more than 60. Okay, so the most common Alzheimer's you see is actually your late onset Alzheimer's.
Thank you, Doc. I think to summarize that, I think hindi siya age factor. Is that correct? Parang maybe
It
that's the
depends, yeah. It depends on the type of dementia the patient would have.
all right. Thank you, Doc. Next question.
Alright, for the so na-address na tong questions po na to, yung with regard dun sa age po, no?
Mhm.
So, ang next po na question here is from Teng Mantalbo. Can we avoid or prevent dementia or senior moments? So it's
Okay.
from
So as it's kind of related to the previous question, since dementia, as I've mentioned, can be caused by several factors. Okay, so what are these several factors that can actually cause dementia? So first, you have your dementia with medical disease. So what are these? Your nutritional deficiency, heavy metal exposure, hyperthyroidism, etc. Okay, that can cause dementia. Another dementia is your dementia that is accompanied by other neurologic signs. So, what are these kinds of dementia? Multiple infarcts, which can cause vascular dementia. Another one is your brain tumor. Okay, and then you have your dementia as the sole or predominant factor. So, what is it? What is this? The most common one, Alzheimer's disease. So, if I answer your question, how can you prevent dementia? It depends on the type of dementia. For instance, if we talk about Alzheimer's disease um, um, comprises several factors. It is age-related problem with the brain connected with your genetic factors and environmental factors. So patients who have genetic factors of Alzheimer's disease, okay, have a high risk of getting Alzheimer's. Okay, but not all get, but they have a high risk of getting Alzheimer's. So regarding prevention of that, I can't totally answer you about preventing Alzheimer's in a patient with a family history of Alzheimer's. Okay, but I think changing environmental factors like minimal chemical exposure or eating healthy, controlling the BP can actually help. Okay, but that is not 100%. Okay, for the other dementias, such as hypothyroidism and hyperthyroidism, which can actually cause dementia, you just need to treat your hypo or hyperthyroidism. The same way with brain tumor. A dementia which is caused by the brain tumor, you just need to treat or operate on the brain tumor to actually lessen or treat the dementia. So it actually depends on the type of dementia and it actually depends on the cause of the dementia.
Right. Thank you, Doc. Thank you. So different factors talaga, no? We can't just simplify it.
Yes.
I think I can relate, Doc, kasi in physical therapy din, no? Some people want a very direct answer to
Mhm.
something, but sometimes there's so many things involved that you cannot just say, oh, ganito yun. Diba? So,
Mhm.
in this way, I would like to encourage everyone na siguro this is a proof that we need to consult talaga with experts. We need to consult with professionals, especially kapag if you want information that is tailored for you, then so to understand what factors really matter for your case. All right. So our next
Mhm.
question,
Mhm.
Alright,
can
so
yeah, go
so
Jan.
ang next question po natin from Miss Jill Marion
Mm,
Go. Can
mm.
people with Alzheimer's adapt to a new environment?
Okay. So, so that's actually depends on the individual. Okay. So it depends on your patient. Okay. It depends on the stage of his or her Alzheimer's, if it's beginning or late Alzheimer's. But if I'll answer it generally, technically patients with Alzheimer's, like what I heard, or what I watched in your video, sinabi ni mommy doon na napansin niya sa mother niya that the patient can actually remember past memories compared to your acquired memories. Actually, that is very true in Alzheimer's disease. Why? Patients with Alzheimer's disease, there's such thing as your Ribot's law. Okay, so Ribot's law, patients with Alzheimer's can actually remember the remote memory. Remote memory meaning yung mga past memory nila, childhood, nung buhay pa yung father, mother, compared to acquired memory. They forget all the acquired memory, but at some point, they always remember the remote memory. So if I answer that question, it would be kind of challenging for a patient with Alzheimer's, especially kapag nasa late stage na siya, to actually change her environment. Kasi yun yung nasanay na siyang environment na kung saan she grew up, the province na nasanayan niya, it would be challenging for a patient to actually adapt to a new environment. Eh, yun yung naaalala niyang environment. Oo. Kaya some Alzheimer's patient actually, big help din sa kanila if you show them kung yung mga places where they grew up, okay? Kasi yung memories, they will remember the memories. Oo. But of course, eventually, patients with Alzheimer's, eventually din, kapag nasa very late stage na, there's a tendency then na they'll be forgetting those remote memories.
Doc,
Alright.
Mhm.
would you encourage na yung nasabi kanina ni Miss Cherry na
Mhm, mm.
ulit-ulitin lang yung mga memories, yung mga kwento.
Mhm.
Does it help them?
Well, the fact na they'll have uh, parang kasi parang my experience with Alzheimer's patients, I see, kunyari nasa clinic tapos they're going to talk about their past. Masaya sila eh kasi parang ano eh, parang, oo, parang I ate that candy before. Parang you see sa faces nila that they're happy. They're actually able to remember the past, and they're actually happy kasi it's a happy memory. Okay? So I think it's some kind of support na din sa kanila na okay lang you talk about their past kasi parang they're able to converse with you if they have a common topic of conversation na they actually are familiar with.
Nice. All right. So be patient na lang talaga.
Alright, so
Question?
there's another question here po from Miss Claire
Mhm,
Cacanado.
mhm.
What are the sources po of toxic proteins?
Toxic proteins, for instance, mga metabolic and problems. Um, yung mga that can cause dementia kasi 'di ba dementia can actually be caused by some metabolic problems, okay? So what are these is the if that's what she meant, okay? So what are these possible problems na can be toxic, okay? First, yung mga patients na kunyari used to work sa mga lead companies, okay? Patients na may history of working sa mga chemical factories, they actually have a higher risk of getting dementia. Okay? If we're going to talk about yung mga work history, another possibility ng toxicity is actually um, um, carbon monoxide, okay? CO. Okay? And then another one, it's actually not toxic, but yung mga pwedeng possibility na can cause dementia, mga deficiency sa B12, folate deficiency. That's why it's very important sa mga physicians before presented with a patient na may dementia. It's very important for us before telling the patient or relative na the patient actually has Alzheimer's, we need first to test yung CBC, liver function, serum electrolytes, thyroid function test, vitamin B12, folate, syphilis screening, HIV screening, and do an MRI before we can actually say na Alzheimer's siya. Okay? And then in relation to the question, yung mga toxicity, it's very important then to do a very good history. Kunyari sa history, nasabi na he's chronically working sa before, sa chemical plant. And then ngayon, he's having memory problems. Clue na yon na maybe that mercury or lead actually caused him to have dementia.
Wow, ang daming factors din.
I think yung pwede din na question niya, yung mga toxic proteins sa brain, like yung mga tau, okay? Because in patients with dementia, okay, would actually have low amyloid, okay? So amyloid is actually a protein sa brain. And then tau, it's actually a protein din sa brain. If that's what she meant, this is seen in Alzheimer's disease. So patients with Alzheimer's disease would actually have low amyloid and high tau if you do a cerebrospinal fluid and then you check for those proteins. That's what she meant with the question.
Yeah, I think this was coming from yung sabi ni Doc Didi kanina. Yung doon nagsisimula.
Sure, Rina.
Okay,
Actually,
so it's the amyloid and tau. Okay.
So with that po, na-address din actually itong question na to from Miss Carol Ecotang na how Alzheimer's disease is diagnosed or detected. So with the discussion kanina by Doc nung yung toxic proteins, na-address na din po. So yung MRI, CBC, blood test, cerebrospinal fluid test, very extensive po yung tests na ginagawa sa isang patient po, no, bago po siya finally ma-diagnose kung meron nga po siyang Alzheimer's or wala. Alright, there's another question po here. May mga two similar questions po sila actually. Nagtatanong kung meron daw po bang gamot or supplements para ma-delay ang dementia or yung mga supplements po for memory loss, kung pwede daw po ba siyang makatulong to prevent dementia.
Okay, so for patients with dementia, okay, or patients with Alzheimer's, we actually have lots of medication. Okay, so what are these medication? First, you have your donepezil. I think this is the most common one. Okay, another common one would be your memantine. Those are the two medications you actually hear in patients na may dementia na they're taking. Okay, other medications that we actually give patients with dementia, especially those with Alzheimer's, are galantamine, rivastigmine, and then you have your patch. Okay, so those are the some medications we start patients with dementia. So, okay, does supplement for memory loss can help prevent dementia? So, there are several studies about this. Okay, so several studies, several conclusions. Okay, So some supplement for memory loss, one example is, I think, your citicoline. Some colleagues actually give citicoline. It's a medication for patients na may starting dementia. Okay? But syempre, there are limited studies about it, um, but but on experience, I still give patients na starting to have vascular dementia or starting to have dementia what you call acetylcholine. Okay? Another one is for patients na may starting mild um mild um Alzheimer's disease, we actually start medications na to delay the progression. Okay? So what is the initial medication we start with patients na may um, mild Alzheimer's disease, we usually start them with donepezil or rivastigmine. Tapos eventually, dadagdag yung memantine, eventually, magiging dalawa na. Okay? So, Alzheimer's disease can't actually be treated, but the progression can be slowed by giving those medications early.
Doc, may I ask, the medications that you mentioned earlier,
Mm-mm, mm-mm.
hindi po to over the counter, no? They have to be prescribed
Yes,
by.
yes, they should be prescribed. Yeah.
Siguro, ano ko lang po,
Mm-mm,
i-emphasize ko yung
mm-mm.
nasabi niyo kanina, yung very thorough screening process to diagnose someone with dementia. We don't just say, uy, parang nakakalimot na ako, may dementia. Hindi siya ganun
Mm.
agad. And it's not like a COVID test or, di ba, na
Yes.
there's
Uh-uh.
so many things na
Mm-mm.
factor in.
Yeah. Like,
Alright.
can I just add to the question of Ma'am Claire? So, kunyari, the dementia is actually caused by a metabolic problem. Kunyari, a patient or your relative is complaining of memory loss. And then you check the blood. Mukhang may hypothyroid. So, I think the best medication for that is to treat the hypothyroid. Because after that, you'll see na the dementia is already being treated, or okay na yung dementia. Okay? So another example of a dementia that can actually be treated is actually your hepatic problems. Kunyari, masyadong mataas yung AST, ALT. So as long as you treat them, it will eventually be treated. Yeah.
No,
So,
on that,
Mm-mm, mm-mm, mm-mm.
what you're saying po, Doc, is for yung mga yung ibang metabolic
Yeah.
cases po na due to metabolic cases, it
Yes.
would be better po to treat the cause first.
The treat
Before
cause first.
actually going to the conclusion na may dementia po talaga siya.
Na may Alzheimer's.
May
Alzheimer's. Yeah.
Yes.
Doc, parang nag-bring into highlight din yung, I would say, yung lifestyle choices. I think ito yung parang bias naman namin. From our perspective as PTs and exercise specialists, yung selection natin of food items, di ba, lifestyle, exercise, I think these can also affect or decrease the chances of getting these conditions later on. Para dun sa mga nagwo-worry, I think parang marami tayong comments na siguro ang dami nilang question kasi they're worried. Am I gonna get it? Am I gonna get it? So parang while there are so many factors, exercise, kumain ng mabuti, umiwas sa mga chemical plants. Those are what we can do.
Yeah, especially if kunyari type of dementia is vascular dementia. So vascular dementia is actually caused by infarct, by stroke. So how do you prevent an infarct? So living lifestyle na healthy, exercise. So it's just connected.
Correct. Wala po kayong takas sa exercise kahit po.
And then there's such thing also as alcoholic dementia. Okay? So for alcoholics, so kailangan hinay-hinay lang sa alcohol.
Ayan na po, narinig niyo na po.
Mag-shot lagi na medyo bawas-bawas na po tayo sa pag-inom. So, dalawa na yun basically po, di ba, Doc? So, with the alcohol alcoholic dementia, so pwedeng brought about siya ng hepatic problem, so sa liver,
Mhm,
tama po?
mhm.
Or
Yeah,
pwedeng
and then
dahil
there's a separate entity talaga na alcoholic dementia. Those
ay
na may chronic drinkers.
Okay, narinig
Oo.
niyo na po sa doctor, guys. Sa mga viewers, alam niyo na, huwag na natin deny.
wag na nating hintayin magkaganon po tayo. Alright, in relation po dun sa medications,
Mm, mm,
we have a
mm.
question here from Miss Jackie Nasis. Are there any side effects on the medications for dementia or Alzheimer's disease?
Okay, so like all medications and vaccines would have side effects. Okay, so what is the usual side effects of the medications used in Alzheimer's? So you have dizziness, low BP, okay, especially, and then bradycardia, okay, and then increased sleeping time. That's why, kunyari, kasi syempre, usually, yung mga patients, we give those medications na yung mga elderly. Okay? So, kunyari, yung patient mo na elderly with Alzheimer's, on donepezil and memantine, they come to the doctor na decreased sensorium because of an infection. We tend to down titrate the medication. Okay? Para hindi totally ma-affect yung kanyang decrease in sensorium. Okay? But it's very important when you actually down titrate a medication for Alzheimer's or dementia, you ask your patient, you ask your doctor. Kasi if the patient is already chronically taking those medications, stopping it abruptly can actually have other side effects. Okay? Kasi chronically you're taking memantine na tas you suddenly stop it. So so you get side effects from the abrupt stopping of using those kinds of drugs. So before stopping it or before deciding to down titrate it, you should actually um tell your doctor. Okay, but to summarize, the usual side effects of drugs for Alzheimer's or dementia are low BP, dizziness, diarrhea, bradycardia. Okay, memantine is actually the least medication which has the least side effects compared to the others.
Alright po. Thank you po, Doc. There's another question here.
Mm-hmm, mm-hmm.
Dami po nating questions. Thank you very much po sa ating mga viewers. Sobrang engaged po nila right now. Alright, so there's this question here. Is it an autoimmune type po ba ng disease? Pwede raw po ba siyang makonsider ba as autoimmune ang dementia?
Oh, that is very interesting. Aabot po ako ng 2 hours to answer that. Okay.
Wow.
So, as mentioned, okay, dementia can be caused by several. Okay, as mentioned, it can be caused by a medical problem. It can be caused by another neurological problem, and then it can stand alone, such as your Alzheimer's. Regarding Alzheimer's disease is a neurodegenerative type of disease. Okay? Neurodegenerative. So it means progression na atrophy yung brain, or meaning lumiliit yung brain. So Alzheimer's disease is actually a neurodegenerative disease. Okay? So, however, there is a dementia na autoimmune type din. So, these dementias are under dementia and other neurological disease. So, if I'm not mistaken, um, multiple sclerosis. Okay, if your multiple sclerosis is located in your brain, since multiple sclerosis is actually an autoimmune disease, if it's located in your brain, it can also cause dementia. Okay? So, kunyari, the question is Alzheimer's disease an autoimmune type of disease? No, it's a neurodegenerative disease. But if the question was, is dementia an autoimmune type of disease? It can be. Okay, especially if it was caused, kunyari, for instance, multiple sclerosis and autoimmune disease located in your brain, it can cause dementia. Okay, so it's a yes and no both. It's a
No?
both yes and no answer.
Parang we need something like a Venn diagram. Ano yun?
Oo nga
Caldereta,
eh.
menudo, afritada. Parang
Kaya
ganon.
nga,
Parang
kaya nga yung
ganun.
mga medical students na hindi pa decided, mag-neuro sila.
Ayun.
Madami pang hindi alam. Ako din, madami ako hindi alam sa neuro.
Okay. There's this question that actually piqued my interest. Let me show it po. From Miss Rosario Bucao. ESP for senior age? Extrasensory perception? Tama po ba? ESP?
No, yan, I think, siya.
Hmm.
Continuation siya ng first niya is being irritable sign of dementia, especially for senior age.
Especially.
Ah, okay.
Wala pa
So,
tayong alien involved.
okay. So, okay. So with that, I'll be discussing, yeah, discussing yung step by step possible symptom of patients with Alzheimer's. I think sa mga questions nila, it's not really dementia. Since as mentioned before, dementia is just an umbrella term, okay, for many kinds of dementia. But from her question, I'll start with is being irritable signs of dementia. I'll start with the degenerative cause of dementia, which includes your Alzheimer's. Okay, I'm not going to talk about the other causes of dementia. I'm just going to focus on the neurodegenerative cause of dementia. Okay? So first, ang unang symptom actually ng mga degenerative dementia is actually mapapansin ng relative or ng employer na yung patient is actually having lack of initiative na sa work, ayaw na mag-routine work, ayaw na gumawa ng mga pleasurable stuff. It's very subtle. Hindi yan agad-agad mapapansin. Slowly pa lang yan mapapansin. Kagaya nga sabi dun sa video kanina, um, the daughter actually said na you can't pinpoint the actual date where it started. You'll just be able to see how it gradually developed. So that is true. That is very true. Kasi sometimes the subtle symptoms of your neurodegenerative dementias can't be noticeable. Okay? And then eventually it will progress. The most common symptom and the most noticeable symptom is your forgetfulness. Dito na masa-start masabi ng relative or ng patient na there's something wrong. Okay? So what are these forgetfulness? Proper names not remembered, balancing checkbooks, hindi na siya makabigay ng change or magbigay ng pera or mag-balance ng check niya mabuti. Okay? Tapos yung purpose niya ng errand, forgotten na appointments are not kept. Okay? So those are the most common and early symptoms of your neurodegenerative dementia. Okay? So until eventually it will progress. And then it will become cognitive na. Ibig sabihin nun, mapapansin ng relatives na hindi na siya makaka-comprehend ng complex situation. Eventually, the patient will have difficulty in the executive functions. So what are these executive functions? Problems in speech, action, thought, not able to do problem solving. And then eventually, ito na, emotional instability of the patient. So eventually, if you start if you start for if the dementia progresses na or the neurodegenerative dementia progresses na, eventually the patient will have emotional instability, and that is one symptom of emotional instability is being irritable. Okay. However, in some neurodegenerative dementias, kasi you have many kinds of neurodegenerative dementias. The symptom I actually just discussed was Alzheimer's disease. However, in patients na may other neurodegenerative dementias, such as your frontotemporal dementias, being irritable and personality changes are actually the first symptom compared to your memory. Mas una silang magiging irritable, mas una silang mapapansin ng patients na disinhibited, mas una makikita na may personality changes rather than the memory loss. Yeah. Yeah. So there.
Thank you, Doc. So parang meron siyang sequence of, ano na, hindi lang siya basta irritable agad. We don't
Mhm. Okay.
Okay. Pero pang mga tinatamad na sa work dyan, kabahan na kayo. Joke. Baka, ayun, I think sa yung parang routine, I think what I got from you, Doc, was, yun nga, walang adequate marker na, uy, may dementia na siya ngayon. But it's like a series of changing, diba, functions.
Progression. Yeah.
Okay. Speaking of symptoms, John, can we maybe talk about these two? So, let's answer Miss Grace's question. So, common ba sa kanila yung naglalaway daw ang patient?
Ah,
Sa,
well, sa later stages ng dementia, um, hindi lang yung part ng brain concerned with executive function, hindi lang yung part ng brain concerned with cognitive function yung nag-atrophy or nasisira. So eventually, later stage in dementia, masisira na din or mag-atrophy na din or neuronal loss na din yung part ng brain which is for movement. Okay? So that is why some patients na nasa later stages na ng dementia, you'll notice they're bedridden. You'll notice lower na yung movements nila. You'll notice na naglalaway sila kasi they can't swallow. Their muscles of swallowing is having difficulty na. So that's why patients na nasa later stage would need mga NGT, would need PEG kasi their muscles of mastication, their muscles of swallowing, their muscles of movement will actually progress or deteriorate slowly. Yeah.
I see. In relation to that, Doc, itong concern naman ni Miss Carol, which is bathing, which is parang what I got from what you're saying is yung basic functions, even looking after yourself, di ba? They need assistance na din. Is that correct?
Yes. Actually, not not wanting to take a bath and not doing the routine good hygiene is actually a common symptom of Alzheimer's disease. Yung mapapansin ng relative na ayaw na maligo ni lola or ayaw na mag-toothbrush, it's one of the symptoms we see in Alzheimer's disease. So, if kunyari, yung relative na frustrate, masyadong pilitin si lola, syempre, mas lalong ma-frustrate si lola, mas ayaw niyang maligo. So, slowly do it. Wag pilitin. If she doesn't like, talk to her to do it. Okay? Or sometimes, samahan niyo sa loob. Okay? Kayo magpaligo and then try to calmly tell her na kailangan niya maligo, ganyan, ganyan. Okay? Important din sa mga patients with Alzheimer's disease. Okay? I think the relatives would really know about this na if irritable or kunyari hindi calmly yung pagkausap kay lola or kay lolo or pinilit siya, mas ma-frustrate si lola or lolo eh. Kaya important din yung communication with them, yung calm communication with the patients.
Great, great. All right. One last question before we wrap everything up. Sige, we're done.
Doktor, ask him po what age po kaya pwede man-develop ang alcoholic dementia. Okay, I'll start with Alzheimer's. Okay, so I think I discussed about this kanina. There are two types of Alzheimer's disease. Okay, you have your early Alzheimer's disease and your late Alzheimer's disease. Okay, and then your early Alzheimer's disease can actually happen before 60 years old. But always remember that early Alzheimer's disease is very rare. The most common one is your late Alzheimer's disease, which happens above 60 or mid 60s. It is the most common Alzheimer's disease. Okay? So for your um alcoholic dementia, it's very different from Alzheimer's since alcoholic dementia is caused by excessive drinking. There's no age, okay? There's no age related to your alcoholic dementia. The most important factor you'll put into consideration is how many years siya nagdi-drink. How many years siyang nag-excessive drinking. Usually, mga over a period of years yan, may history of excessive drinking. Okay? So, yeah, that one.
All right. Okay. I think we can wrap up our conversation then. Maraming salamat. I wish we can answer more, pero sabi nga ni Doc Mia, ganito siya ka-interesting. Baka umabot pa tayo ng 2 linggo. Nag-uusap lang tayo lahat. We will be posting 2 more yung videos po. Ipo-post namin dun sa event page ng Facebook natin. Facebook event. So that you can all watch it at your own time and then interview din with Miss Cherry and Miss Baby. So we'll let you go na Miss Mia, Doc Mia. Any final message siguro, Doc Mia, before we let you go?
Thank you. Okay.
All right, thank you
For the
po.
undergrads, go to
Oh,
neuro.
yan na.
We need
Neuro
more
kayo.
neuro.
Thanks, Doc.
Thank you po, Doc.
All right, John, how was it? Ito na, we're wrapping up our talk.
I mean, ang dami ko natutunan. Ang dami ko natutunan talaga.
Same din ako actually. Dami kong answers na nasagot. Hearing different perspectives. Para akong nag-review ng neuroanatomy kanina. So, nakakamiss.
I mean, it brought a lot back of memories nung undergrad pa ako na ang katutak ng inaaral namin tungkol sa neuro, especially ito nga, dementia, age-related memory loss, and everything that comes in between. So, wow. Tama nga yung sabi ni Doc, 2 hours, no? Yung sobrang in the zone na tayo nung pag-uusap tungkol doon sa dementia.
Alam mo tong community talk dapat pang 1 oras lang pero hindi talaga sapat. Hindi sapat ang 1 oras. It's always been running almost 2 hours. So, thank you so much po for everyone who stayed, who jumped in and out. Talaga po appreciated namin ang inyong presence. You can watch this at your own time, anywhere in the country, anytime. Okay, any time zone pa yan. And if ever you need to connect with our partners, Sunshine Place is a great support group to our senior citizens. So you can look them up on Facebook and YouTube also. Sunshine Place sa Jupiter, Makati po yan. Active Care is also the same. If you need assistance, no, halimbawa, nasa later stage na nga tayo ng dementia and you might need a coordinated group of professionals to look after your family members, Active Care Home Health Solutions is also on. And lastly, if you need physical therapy, we are here, Kakayanan Physical Therapy Group. We're also here on Facebook, Instagram, and alright. Sige, final message from you, John.
Well, so syempre na-mention na rin natin no na tawag dito may maitutulong din ng PTs for treating dementia. I mean for managing dementia, Alzheimer's or all the similar cases with age-induced memory loss. So I think pwede naman siguro no pag-usapan natin just for a short bit lang kung ano ba yung magagawa nating mga PTs for helping patients and their families na merong Alzheimer's.
O nga pala, I almost forgot. Okay, let's go. Okay.
All right. Discuss po the role of physical therapists in managing or helping patients with Alzheimer's and dementia or yung mga age-induced memory losses. All right. So these are so basically us PTs what we could highly suggest and what we could give is yung physical activities or yung exercises na tinatawag. So physical activity has been shown to improve brain health. It's one of the most effective ways po of improving yung ating brain and mental health. And regular physical activity throughout the stages of Alzheimer's have been shown to improve balance, blood flow to the brain, endurance, flexibility, and muscle strength. So, let's discuss itong four main things po na naitutulong ng physical activities sa patients with Alzheimer's or with dementia. So, una po sa lahat is decrease aggression and improve mood. So, ang basically po tayo, 'di ba? Pag we engage with physical activity, parang pagkatapos natin, let's say, mag-workout, mag-zumba, yes, pagod tayo, pero yung ibang klase ng pagod, 'di ba? Parang ang saya natin, sobrang fulfilling mag-exercise. So basically, ganun din yung nagiging effect niya sa seniors. So, yung tinatawag na endorphins. So, when we do physical activity, it triggers the release of endorphins na nakakatulong para ma-relax ang ating utak. So, basically, decrease aggression and improve mood throughout the day or throughout the days to come. Next, so aside from syempre pampakalma siya, ang exercise, ang physical activity, nakakatulong din siya sa pagpapataas ng mobility at strength. So, the more that we move, the more that we can move and stay strong. Kasi nga, lagi nating nagagamit yung ating muscles. Also, syempre, with the constant movement, aside from we can move more, we gain more strength, syempre yung bones din natin mas napapabagal din natin. Syempre with seniors, very prone sila sa mga bone problems. So with active mobility, mas mababa yung chances na magkaroon sila ng bone related problems or mas mababa yung incidences if ever meron na silang existing na bone related problems. Next is yung maintain independence throughout activities of daily living or ADLs na tinatawag. So, kahit naman na let's say may early onset na or may early signs na ng dementia ang mga patients, they could still perform yung mga activities na alam nilang gawin on their own. And that's what that's where physical activity comes. So yung ibang mga exercises, we PTs can modify the exercises to simulate yung activities of daily living na tinatawag. So we could pattern yung mga exercises base sa kung ano yung usually na ginagawa ng mga pasyente with dementia. And lastly, slow the loss of memory. So with constant movement, as I've mentioned before, so may release ng endorphins or ito yung ating mga mood stabilizers or yung feel-good hormones na tinatawag. So the more that we move, it improves din yung blood flow sa ating body at sa ating brain. And there's this research that found out that 40 minutes, at least 40 minutes of physical activity 4 times a week over a year, so nagkakaroon ng growth sa hippocampus. Ito yung area responsible for the memories that we have. So dito nagfo-form yung mga memories natin. The more physical activity that we do, mas less yung kumbaga yung chances na mas magiging makakalimutin tayo kasi mas nagiging active yung katawan natin and yung brain natin. So I hope you understood and you were able to learn sa ating live stream.
Yeah, thank you din, John, for clarifying ang role. Kasi, di ba, physical therapist, sometimes hindi pa siya fully understood. Ano ba talaga ang nagagawa ng physical therapy? And one of the objectives of our community talk is to expand the view of what physical therapists can do. So, we are actually able to help anyone at any stage in their life. Isa yan sa mga malagang part ng definition ng physical therapy. From a child who is limited with movements to an elderly person who needs to move. So talagang movement lang po. May quote na movement is medicine, and that is what physical therapy is trying to advocate for. All right? So in saying that, so please follow us on Facebook at Kakayanan PH sa mga gustong mag-connect. We had really good feedback from today. And ayan, and actually while we are signing off, I will show those nice comments that we heard from them. So magkakaroon pa po ng marami pang community talks. And in October, we will talk about mental health.
Yes.
In
So this
November,
October ang tinatawag po na Mental Health Month. So kindly stay tuned sa aming page sa Kakayanan on the third week of October. So that's the third Saturday of October. We will have again another community talk. Focus naman po is mental health. So everything about mental health po ang ating pag-uusapan sa susunod na Kakayanan Community Talks. Again, so
Okay.
thank you very much po sa lahat po nang nag-tune in today. At thank you din po sa mga manonood pa after nitong live stream na ito. Again, this is your physical therapist, Jan. Thank you very much po.
And this is your physical therapist, Josh. Thank you for spending your afternoon with us now and later on and in the future. Okay, we'll be signing off the po. Enjoy the rest of your weekend. Bye-bye.
Bye-bye po.